VUZE is pretty much a game changer. It gives me advantages of more complex, cumbersome navigation systems with the ease of use of just plain X-ray guided percutaneous procedures.
I often have the dilemma whether to use a navigation system or standard fluoroscopy when instrumenting the spine. With the VUZE system, I get the advantages of both systems and avoid in the same time the disadvantages.
At first, I thought I would just use it for verification purposes, but very quickly I saw that it helps me all along surgery, starting with the planning, incision, insertion, deployment, and verification of the screws inserted.
So when it comes to percutaneous spine procedures, there's always the dilemma between using navigation system and just plain X-ray guidance. The obvious advantage of using navigation is its accuracy and reliability. The big disadvantage of navigation system is that it's very cumbersome. Now in comes the VUZE system, and for us as a user, what it means is that we do the percutaneous procedures just as we would normally. No need to use lateral images, and then the computer program, the VUZE program, just grabs the image from the fluoro machine and gives us a simulated 3D image of the position, first of the tools, and then ultimately of the position of the implants in a 3D view, just as a navigation system would.
With one shot, we are able to see the surgical tools overlaid on the axial and sagittal planes.
Now the big advantage is that we don't need to use special tools, there are no tracking cameras, you don't need a big cumbersome imaging modality. After we complete the procedure, we do a 3D image scan of the patient on the operating table to see how close the real position of the implant is. It compares to the simulated image the VUZE system gave us, and I'm happy to say that the accuracy is excellent. To our contentment, the position of the screws, the position of the cement, the position of the needles we've been using is as it appeared on the VUZE computer system.
I'm very impressed with the accuracy and the simplicity of the system. It's an extremely powerful tool.
We felt very comfortable, and all insertions were perfect.
So for me, the VUZE is pretty much a game changer. It gives me advantages of more complex, cumbersome navigation systems with the ease of use of just plain X-ray guided percutaneous procedures. So I expect I'll be using it more and more in the future.